I can certainly try. So, this is the question of the moment, right? And unfortunately, I don't know that we can answer it definitively, but we have some clues. So, it's still an unknown. Things are emerging, and there is suggestion that some of these people will have long-term consequences. So, it's very easy to see how someone who went through a prolonged course of illness, long-term ventilation, and long-term ICU course could have long-term pulmonary and cardiovascular complications. That's a well understood sort of phenomenon of being in a critical illness state for that long. Similarly, the things I mentioned before about critical illness myopathy, which is muscle involvement, or neuropathy, damage to nerves, that's a known consequence. There's also, for every known way we can get to a long-term possibility, there's also a myriad of others that could turn out to be true. I've mentioned there's a few case reports out there already where people who had COVID-19 are in subsequent weeks in a time frame that really makes sense for an autoimmune encephalitis type of presentation, are developing what looks like encephalitis. Sometimes they have antibodies, most times they don't, but their presentation looks like that. And there are MRI findings in some instances that are consistent with that. So that's one way you can get to a long sort of roller coaster, again, recovery and then subsequent problem. And then I'll share a story, because I think the stories are data with the soul, right? You have, I've seen patients who, they went through their acute hospitalization. The focus was very appropriately on saving their life, getting them cardiovascularly and hemodynamically stable. And on the back end of it, it turns out they have subtle but very objectively verifiable cognitive deficits that map with a pattern of a hypoxic brain injury. So these things aren't always picked up during the acute hospital period when the focus is appropriately, like I said, elsewhere. And so we're going to see these patterns emerging more and more over time. And yeah, I think that's. I'll stop and let someone else get a word in edgewise. But I think there's a lot of ways we can get there.
Yeah.
Deborah, go right ahead.
Oh,
yeah.
I would just add to that. I mean, because the topic, around the neurological aspect of things, and you're looking at encephalitis. Well, what does that mean, right? What does that mean? Well, that means that the claimant could actually have difficulty with executive function, right? Really using judgment, skill, higher level executive skills, memory. They're going to struggle with that. And so you're going to see challenges where, there's going to be some association with their job duties that they don't feel that they're able to perform, and it's real. But the other challenge to this entire condition is that you have this confounding component that you really can't separate, which is the mental health aspect, right? The mental health aspect could actually confound if the person is dealing with anxiety and depression of such a degree that is impacting memory and executive function. How do you separate that from a claims handling perspective? And so when you're handling these types of claims, I would anticipate, you're going to be doing not only looking at the physical condition, but you may need to be deploying, neuropsych testing. You're going to need to deploy, some psychoanalysis, working with the psychiatrists and the mental health professionals to try and tease out, what portion of this claim is actually physical and what portion of this claim is mental, and recognize that these things go together, and it's going to take some time. The good news is, I guess the bad news is, what is long term, right? It's only been a condition since March 11, right? Coronavirus, that's when it was announced, March 11. So we're not what we would consider in a long-term phase. However, studies thus far are favorable that they aren't permanently impaired, that people aren't becoming permanently impaired. But that being said, as Dr. Ashley's already stated, we really don't know yet, the long-term effect. But I just wanted to you know, not to I know Mark may have some more to say about that, but you've got these confounding things that can also mimic one another.
Mark, did you have anything to add?
Well, you know, Deb, I've got an opinion about everything. So, you know, when you talk about the roller coaster effect, I mean, we've all been there, right? Not to pick on an individual, but Dr. Fauci back in January said COVID was no big deal. And then all of a sudden in March, we're all going to die from it. And, you know, depending upon your perspective, you know, you thought it was over in May or June when we started reopen. I remember shelter in place. I'm in Atlanta, and our shelter in place finished on April 30th. 8 hours after midnight, I was in a car to Panama City Beach because I'd had enough. And Florida and Alabama both had opened up, you know, shelter in place as well. Some folks around the country were not there and really haven't been out of that. My mother is 83 years old, and she has been basically secluded in her apartment. This past Saturday, I took breakfast to her, and we sat at a picnic table 6 feet apart. I try to do that every couple, 3 weeks, take groceries to her, but they're not allowed visitors. And she said people inside her apartment complex literally have aged, not just mindset, but literally their hair's grown grayer. They're walking with a limp. They're having all of these other comorbidities that pop up. I mean, it's having a debilitating effect. And when you think about, you know, mainstream media and social media, you know, if it leads, it bleeds, right? I mean, so they don't have any really stake in the game to talk about the positives. But if you want to look at the positives, you know, the recovery rate is somewhere between 97% and 99.75%. So chances are really, really, really good that you're going to recover from it. Now, what the implications are in your recovery, we don't know. But if you're a catastrophizer, back to my original point from a biopsychosocial comorbidity, if you're a catastrophizer, you're guaranteed to think that you're in that 0.25%, regardless of what happens. And so you're riding that roller coaster. So, you know, and this is, you know, fortunately, me and my family have not been touched by COVID. None of us have contracted it. None of us have had any interruptions in our income. So I consider myself blessed. Although I've certainly had the mental challenges of being at home and not traveling like I usually do. But you read about these people that, you know, they came in contact with somebody and then they're guessing as to whether they're going to have, you know, come down with it. And then they get your test and then they have a test. But ridiculously, you might have to wait 5 or 7 or 10 or 2 weeks, to get your test results. You may be dead by the time you get your test results back. And then test results come back and you kind of understand that you got comorbidities, or maybe you don't, or maybe you're not really sure, because the comorbidities have been evolving too with this novel coronavirus. So you got all that waving to your head, and then you start seeing the onset of symptoms, and you start coughing, and you start having the fever, and then you go, oh man, it's starting. And then you see the health decline, and all this time you're watching CNN and Fox News and watching Twitter. Please don't go to Twitter. But all these things and Facebook and everything that says, all the negative things are happening, all of a sudden your mind starts racing about, this is what's going to happen to me. And maybe it does happen to you, and you get in the ICU and you're not having any physical contact with anybody whatsoever, no friends, no family, maybe FaceTime on a phone. You don't see anybody's faces because everybody's in a mask. In fact, they're in double masks. And you got all sorts of tubes hooked up with you. You're missing birthdays. You're missing anniversaries. You're missing a lot of different things. So when you talk about the roller coaster effect, yes, it's health related, but it's also mentally, emotionally, and spiritually exhausting to go through this process when you don't know the end result. And so back to the biopsychosocial spiritual, that all of this stuff is happening besides what we've been talking about from a health standpoint, but you got to take into account that this is having a dramatic impact and influence on this person's ability just to cope on a day-to-day basis.
Right. Well,